Many of you have heard the statement, "What doesn't kill you makes you stronger." The reality in this statement may not be so true. Mr. Johnson arrived at the clinic with severe headaches, fatigue, and complaints of blurred vision. He states he has no medical condition and no past medical history. I quickly assessed his blood pressure, which read 200/105. High blood pressure is called the silent killer, for a good reason. You can have it and not even know it. Most of the time, high blood pressure has no symptoms. So if you do not have your blood pressure checked regularly, the first sign could come in the form of a stroke or heart attack. According to the American Heart Association, around 75 million Americans aged 20 and older have high blood pressure, also known as hypertension. Yet many people don't even know they have it. If you have high blood pressure, you need to know so you can control it. If you don't, you increase your risk for serious illness. Blood pressure can be measured by utilizing 3 important steps: gathering the materials, following a specific procedure, and interpreting the blood pressure reading. Let's first start by discussing the materials needed in order to take the blood pressure. The first step is gathering the materials. You will need a sphygmomanometer with a gauge and a special cup. A sphygmomanometer consists of an inflatable bladder enclosed in a non-distensible cup. The bladder is connected to an inflating mechanism such as the bulb or the pump. You will also need a stethoscope. A stethoscope is absolutely necessary and should be equipped with a bell and a diaphragm. Now that you have gathered your materials, let's discuss the specific procedure. To properly take someone's blood pressure, you must follow specific procedures. You also must use a properly sized cup. Measure the blood pressure with the arm at heart level. Wrap the cup around the upper arm with the bottom of the cup about 1 inch above the antecubital space. According to the American Heart Association, the width of the cup bladder should be at least 40% of the circumference of the midpoint of the limb. Palpate the arm at the crease of the arm and locate the strongest pulse. Place the bell of the stethoscope over the brachial artery at this location. Rapidly inflate the cuff to about 180 millimeters. Release air from the cuff at a moderate rate of about 3 millimeters a second by turning the dial to the left. Listen closely with your stethoscope while simultaneously observing the sphygmomanometer. The first knocking sound you will hear will be your patient's systolic pressure. The knocking sound is also known as the paroxysmal sound. When the knocking sound disappears, that is the diastolic pressure. Now that you know the materials and the specific procedure, what does the actual reading mean? When interpreting a blood pressure reading, the result is usually recorded as 2 numbers written as a ratio like this. The top figure is the systolic, which is a measure of the pumping action of the heart muscle itself. The bottom figure is the diastolic, which indicates the ability of the arterial system to accept the blood forced into the system. According to the CDC, blood pressure should normally be less than 120/80. Hypertension is the condition in which blood pressure is chronically elevated. According to the fundamentals of nursing, for adults of any age, blood pressure between 120/80 and 139/89 is considered pre-hypertension. Anything above 140/90 continuously should be evaluated for hypertension. Hypotension is blood pressure below 100/60. Low blood pressure readings can be normal for healthy young adults and are most of the time no cause for concern. According to the American Heart, 1 in 3 U.S. adults have high blood pressure. One problem is that high or low blood pressure usually doesn't produce symptoms. People may not even know they have it until it begins to cause trouble with the heart, brain, or kidneys. Checking one's blood pressure should be a part of each physical examination. It only takes about 30 seconds to check. I urge you to put forth the extra time and the little effort needed to help yourself live a long, healthy life. Monitor your blood pressure.